Hey everybody, Dr. Schultz with the Centeno-Schultz Clinic with another weekly update. We're continuing our discussion on the thoracic spine, and today we're going to be discussing what in the world is thoracic spondylosis. So thank you so much for checking in, and let's get started. So the goals of this presentation are to understand what in the world is thoracic spondylosis, what are its causes, what are the symptoms, and most importantly, what are the current treatment options? So spondylosis is a medical term. You don't hear that very often outside of medicine, and it basically describes a degenerative process affecting the spine. Generally the wear and tear that you and I have as a result of what we do on the weekends and on our time off. So thoracic spondylosis is basically a degenerative condition involving the thoracic spine. And what in the world is the thoracic spine? It's that section below the neck and above the lumbar spine. It's sometimes referred to as the mid-back. So thoracic spondylosis is a degenerative condition involving the mid portion of your spine. So what areas can be affected? So I wanted to discuss this, and basically all the structures in the thoracic spine can be affected by this degeneration, which include the vertebral bodies, which are the bony building blocks that stack one on top of the other. The thoracic discs, the space between the building blocks that act as such an important shock absorber. The thoracic joints, there are many, we discussed that previously, which include the facet joint as well as the costotransverse joint. The thoracic muscles, the ligaments, the spinal nerves, including the spinal cord, all can be affected by this degenerative process in the thoracic spine. So what are the causes of thoracic spondylosis? Aging, as you can see, it's going to occur to everyone as we get from youth to middle age to as we get older. It's going to happen as a result of the activities that we enjoy. Genetics, there is some predisposition in certain families. Poor posture can certainly aggravate the wear and tear. It puts enormous pressure both on our cervical spine as well as our thoracic spine as we lean forward looking at screen time as well as computer time. Repetitive strain as well as trauma. The symptoms of thoracic spondylosis can be mild, moderate, or severe, and they actually just depend upon the location and the severity of the degeneration. So the major symptoms associated with thoracic spondylosis include pain. The pain can be on one side or the other. It can be intermittent or it can be constant. It also may just be localized in the mid portion of the spine, but it also can radiate outward along the flank and chest wall. It also can go into the abdomen as a result of irritation or compression of some of the nerves in the thoracic spine. You can also, depending upon the severity, have some numbness and tingling in the lower and upper extremities, and some patients with thoracic spondylosis complain of difficulty walking, difficulty feeling their toes and legs. And then when severe, you can actually have bowel or bladder dysfunction, certainly an embarrassing symptom that's frequently discussed. So how in the world do you diagnose thoracic spondylosis? Well, it's multifactorial and there are lots of different steps, but it always starts with a good medical history, a thorough physical examination. That's one of the cornerstones here at the Centeno-Schultz Clinic. We spend time with our patients. We listen to their history, what triggered the event, what makes it better, what makes it worse, and we actually touch our patients by performing a thorough evaluation on physical examination. And then there's the question of which additional studies. So let's talk about radiographic studies that can help with the diagnosis of thoracic spondylosis. X-rays are readily available. They are low cost. There's limited radiation, and they give you a good idea of the bony structures. That's right, the bone. As you can see here, you can see the vertebral bodies, Those are basically the building blocks of the spine. You can also see the facets, but what you don't see, what you don't have a good idea of, is the soft tissue, the muscles, the tendons, the ligaments, the nerves, the spinal cord, and the disc. So while X-ray is important, it's not the end all. So for the diagnosis of thoracic spondylosis, MRI is the gold standard. Why? Because it gives us detailed images of the thoracic discs, the facets, the ligaments, the tendons, the nerves, and whether or not they're being compressed, and the spinal cord. What are the common treatments for thoracic spondylosis? When appropriate, you always want to start with conservative therapy. That would include physical therapy, chiropractic care, rest. You also want to initiate safe medications, turmeric, good quality fish oil. And then when conservative care and medications doesn't work, often some patients are referred for steroid injections. Just beware, steroids can cause significant complications. Thoracic steroid injections are associated with those patients, with those providers that are not highly skilled and have an extensive background in this, can be associated with complications such as a dropped lung, also known as a pneumothorax, which is a bad day for everyone, as it may necessitate the chest tube placement and may impact cardiac function. So surgery is rarely indicated. It should always be the last option. And you can see here to the right, this is the thoracic spine, this is the vertebral body, and you can see a set of screws that go into the vertebral bodies, followed by some rods. This is a fusion, and it is a significant surgery associated with significant risks and complications. The complications can be life-changing and permanent. The only exception for the rule in terms of surgical intervention are for those patients that have abrupt and progressive neurologic deficits or gross instability as a result of trauma. At the Centeno-Schultz Clinic, we are experts in the evaluation and treatment of thoracic spine injuries. The advantage of us is that we're all board certified, fellowship trained. We have extensive knowledge and experience in the treatment of thoracic spine injuries, utilizing both X-ray as well as ultrasound. Treatment options include PRP, platelet-rich plasma, as well as bone marrow concentrate. If you or a loved one continue to suffer from thoracic pain, give us an opportunity to discuss your history and possible treatment options. Thank you so much today for checking in. We'll see you next week.